In this session, we're going to focus on how to write high-quality comments on learner evaluations. It's great to give verbal feedback, and that's really helpful in real time to help our learners improve. But it's also important to document those comments on their evaluations as reminders for the students, as well as so they can be visible to the educational program leaders. So let's look at a fairly typical comment that one might see on a learner evaluation. I greatly enjoyed working with student A. She's a delightful person, full of energy, and seems to like clinic, even though we were really busy. Nurses, patients, and families all love her. I could trust her, and she met all my expectations. I would be happy to work with her again. Now that all sounds lovely, but if we pause and think about it, what are we really gleaning about student A's performance in the clinical setting? How will this comment help her get better than she already is? This is a comment that kind of feels like junk food. The kind of comment that we all love to see, glowing positive assessments, but not really anything that we can sink our teeth into to become better doctors. So let's talk about some basic characteristics of high-quality feedback. We want to be specific rather than talk in vague generalities. We want to have it focus on the behavior of the person rather than using adjectives that describe personalities or judging who they are. We want to provide some sense of balance to provide both reinforcing and constructive. Here's a graphical representation that shows how growth in clinical skills occurs in layers. If we think about where our learner is currently, maybe their skill level is down here, and we know that eventually we want them to attain this degree of competence to graduate. So there's a gap. We know that the learner is here, they need to get all the way up to here, but they can't do that all at once. So our job is to show them the next step. We want to start with where they are and reinforce what they're doing right so they keep doing it. And then show them each successive step toward their goal. As we're writing comments on evaluations, I think it's important to keep in mind both audiences to whom we're writing. First, and perhaps most importantly, the learner. We want our evaluations to offer them growth-oriented feedback, where we're coaching them to the next step, more than judging them. These comments are important for our educational program leaders, like program directors or clerkship directors, where we need to provide a very candid assessment of that learner's skills and potentially convey any areas of concern. And this is somewhat a balancing act of trying to meet both of these goals through written word. So as you're thinking about composing comments on a learner's evaluation, think about all 6 core competencies of their work in the clinical setting. What are some of those competencies where we can reinforce excellent skills? And then what are some of the competencies that they need to work on? And then can we give them a really practical next step? So for this learner, a student on a general surgery rotation, the faculty identified that she lacked an awareness of a lot of the common presentations of surgical emergencies, and that was super important for the rotation. However, the student was able to provide really organized and concise verbal presentations, take a whole lot of information, distill it down, get it out in less than 2 minutes. She was really engaged, like really involved with the patients, would circle back around multiple times a day, checking on the patients and families and making sure they didn't have questions. However, you noticed that when the upper level resident or yourself tried to offer constructive feedback about her medical decision making or differential diagnosis or plans, she sometimes tended to deflect that and blame it away on bad information or what someone else had said. So wrapping all that up, think about how we can phrase those terms and those observations in a way that this learner is going to absorb as constructive feedback. Let's look at a different learner. Again, thinking broadly across all 6 competencies. Maybe this learner, in discussions and kind of hypothetical discussions, had an encyclopedic knowledge of pathophysiology and could recite all the evidence-based guidelines. However, you also noticed that when trying to apply that information to specific patients, wasn't really able to see the forest for the trees. So you might write something like advising them to use simulated cases to practice applying their knowledge to kind of some of these real world scenarios where presentations aren't always kind of the classic textbook. You noticed that when they were talking with patients and families, they usually used a lot of medical jargon or really complex speech patterns. So you should encourage them to translate that to plain language. Maybe you noticed that the student or intern didn't really know what other members of the team, what their roles were, so they were taking it all on themselves to do all the little pieces. So now you can encourage them to be more efficient by organizing their work more effectively amongst the interdisciplinary team. So when we're offering written constructive feedback, our words have power. And I think it's important to think about how we phrase them. Keeping in mind, our goal is to show them how to do it better next time. So here's some helpful phrases. I encouraged him to, next time I'd like to see him, to strengthen this clinical skill, she should do that. You can even sometimes build on an existing strength. So for a learner who has good rapport with patients and families, you might say, but you could be even more effective with counseling if you simplify your speech, slow down, and check for understanding. So putting it together, here's a way that one might phrase a complete comment for a student. Student Sam asked focused questions to fill knowledge gaps and was effectively accessing the medical literature. Communication with families was great. He sat down, very conversational yet complete in info gathering. Areas for growth we discussed were being careful about premature closure and acceptance of someone else's plan. I really want her to approach the patient with an open mind and get to the diagnosis that she comes up with herself. It's also critically important that our written evaluations not contain surprises. So we should be consistent with what we see, what we say, and what we write. And if there are serious concerns about a learner's performance, we should tell the learner verbally. That's a crucial first step. Next, alert the clerkship or program director, and then describe the skills or behaviors on the written evaluation. So if we have particular concerns, here are some strategies to write those concern comments. We discussed my concern about gaps in medical knowledge. I shared with her concerns about feedback from the nursing staff regarding responsiveness. And sometimes, even if you've had an opportunity to debrief and verbally talk with the learner, incorporating some of their self-assessment into your written comments can also be really helpful because it sets that collaborative tone. So she identified that she felt overwhelmed and disorganized. We discussed strategies like to-do lists and flags to help manage that information. Now let's practice. On the left, we see a comment that might be fairly typical about a student. Steve was fun to work with, but often seemed disorganized on rounds. He needs to focus more and realize the importance of what we're doing. How can we rephrase that comment to capture some of the same themes, but in a way that's more specific and growth-oriented?